How does breastfeeding affect your pelvic floor postpartum exercise? Imagine holding a tiny miracle in your arms while trying to get back to your fitness routine. You might wonder how breastfeeding influences your pelvic health during this time. Well, it's a common question and worth understanding. When you breastfeed, your body produces higher levels of the hormone prolactin, which helps with milk production. At the same time, estrogen levels stay low. This hormonal change can affect your pelvic floor muscles in several ways. Low estrogen can cause decreased vaginal lubrication and make the tissues less elastic, which might make exercises feel different or uncomfortable. Reduced blood flow to the pelvic area can slow down tissue healing and make muscles less responsive, especially in the first few weeks after giving birth. Some women notice more pelvic discomfort or sensitivity during workouts while breastfeeding, especially if they're doing activities that put pressure on the pelvic region. But here's the good news. Research shows that breastfeeding does not delay long-term recovery of the pelvic floor or increase the risk of issues like incontinence or prolapse. Most of these effects are temporary and tend to improve once hormone levels return to normal after stopping breastfeeding. When you're ready to start exercising postpartum, it's best to begin gently. Focus on pelvic floor exercises like slow Kegels or pelvic tilts to rebuild strength and awareness. Pay attention to your posture and alignment during workouts, especially when sitting or lifting, to avoid extra strain. Wearing supportive clothing or pads can help if you notice increased leakage or discomfort. Staying well hydrated and eating nutritious foods supports both milk supply and muscle recovery. Deep belly breathing can also help reduce pressure on your pelvic floor during exercise. Inhale deeply through your nose, letting your belly expand, then exhale slowly through your mouth. This technique helps with core stability and pelvic relaxation. If you experience ongoing pain, heaviness, or leakage during exercise, consider consulting a pelvic floor physical therapist. They can guide you through personalized routines and address specific concerns. Remember, breastfeeding can temporarily influence your pelvic tissue health and comfort, but it doesn't mean you can't safely return to exercise. Starting slow, using proper form, and listening to your body will help you support both your fitness goals and your pelvic recovery during this special stage of motherhood.